Hi, my name is Sara Dayani. This is my video assignment for Health 3110 with Professor Morgan, and I am working with my friend Amelia Henham. Perception checking. Background. This is about two coworkers, Sarah and Brittany. Sarah has noticed that Brittany has been coming to work late every day and has been distant with Sarah. Hi, Brittany. I've noticed you've been coming to work late lately, and it feels like you're ignoring me. Is everything okay? Are you mad at me?
Hi, Sarah. I'm not upset with you. I've been late lately because my child has been sick, and it's been pushing me off of my schedule. I will start managing my schedule better so I can get to work on time.
Okay, I hope everything works out. If I do something that upsets you, you would let me know, right?
Yes, I would.
Number 2, developing empathy. Pillow method. Background. Sarah's mom wants her to finish her degree, but she works a full-time job to pay bills and can't afford it.
You need to go back to college and finish your degree. It will be better in the long run, and you can accomplish something great.
Mom, I have bills to pay and college is expensive. I don't want to work a full-time job and not be able to get the best grades since I won't have time for school.
You're right. If the situation was different, it would be better. You won't be able to focus your time in your studies, which can have a worse outcome. The last thing you want to do is pay thousands of dollars and not do well.
Exactly. I don't want to work long hours to pay for school when I won't be learning, especially during these times when everything is online. It will be hard for me to stay on track.
But furthering your education and obtaining a degree is important. It will get you a better paying job, and that way you won't have to work at such long hours.
I understand, but I need to focus on my life right now. If I start going to school, I will need to cut my hours. Then I'll be paying for school and my bills.
Well, you can take out a loan, and then when you get your new job, it will be easier to pay it off.
I understand, but just because I have a degree and the education does not mean I'll get the job. I don't want to be job searching and then have my interest for my loan keep building up. I am planning on going back to school, just not right now. I need to be at a better place where I can focus on my education instead of burning out and failing.
Well, I'm glad you still want to eventually finish your degree. It's good you looked at all the options, and it probably will be better for you to go when you're more stable. I don't want to force you into doing anything you don't want to. I'll support you either way, but I do want you to do what you think is best for yourself.
I'm glad you understand your situation. I promise I won't let you down, and I will finish my degree eventually. Number 3, listening skills. Sarah is venting about a patient who is giving her a hard time, even though she's been working really hard to keep them comfortable and not take too long. I feel terrible about this one patient.
What's going on?
They're giving me such a hard time.
What makes you say that?
Well, when they first walked in, they had an attitude. I tried to make conversation, but they obviously did not want to talk. They stopped me multiple times and just made it really hard for me to do my job.
So this patient has an attitude, and since they kept stopping you, it's making you late for your next patient's schedule?
Yeah, now I'm gonna end the day later than I thought because the patient wanted to be difficult.
Well, you're a really good hygienist, and I'm sure you've tried everything to minimize any pain and discomfort. Your patients might overlap a little bit, but I'm sure you will be able to handle it.
Yeah, I try to give a patient a thorough cleaning, but being interrupted every 5 minutes makes that hard.
Well, the patient probably had dental anxiety. It's very common in patients, and they were probably nervous, which makes them come off as rude.
Yeah, that's true. I remember how it was when I was in the chair. I need to be more patient with people since sometimes going to the dentist can cause them to be anxious.
There you go. Did it help put yourself in their situation?
Yeah, it did. Receiving and responding to criticism. Boss gives criticism to Sarah, saying that she's been rushing on patients and not giving them proper treatment.
Hello, Sarah. Can I speak with you privately?
Yeah, of course. What's going on?
It has been brought to my attention that you have not been cleaning the patient's teeth properly.
Can you explain to me how I've not been successful?
Well, is there anything that you have changed in your routine over the past month?
Well, I guess since we've gotten more patients, I want to finish them all within a time frame so I don't overlap or stay later than I'm supposed to.
I understand that you don't want patients back to back or to be behind on patients, which may cause you to rush.
Yeah, I don't want to be behind and have to deal with upset patients.
Well, try to take your time when cleaning teeth. Being behind 5 minutes won't mess you up too much. It is important to deal with patients one at a time, or else it can get frustrating if you only look at the schedule.
I understand. Will there be any harsh consequences for my mistakes?
No, just take your time with the cleaning and pay attention to one patient at a time, even if that does mean you're a little bit behind.
Yes, ma'am. Number 5, win-win problem solving. Sara shadows a hygienist and they're giving her a hard time. She wants to confront her to solve the problem in hopes it doesn't create a new one. Brittany, I have a problem with how you ignore my questions and won't allow me to obtain the information I need to be successful. Would you like to go to lunch with me this afternoon during break? I have some things I'd like to speak to you about.
Sure, Sarah.
Thanks for having lunch with me. I just wanted to explain to you why I've been having a problem. It may have not been intentional, but I need to shadow in order to be successful as a hygienist when I graduate. I want to learn as much as I can. When I asked you a question while you were working, you completely ignored me. This made me feel as if you didn't want me around and discouraged me from asking more.
Sarah, I apologize. When I am working on a patient, I get really focused and tune everything else out. I didn't mean to ignore you. I like having you shadow me, but I'm sorry if I made you feel otherwise. I'm glad you told me about this because I honestly had no idea you felt this way.
That makes me feel better. Maybe we should come up with a solution to make this situation better. Maybe I'll write down the questions while you're working so that I don't interrupt you and then ask you when you're done with that patient.
Yes, that works. You can also stand on the other side of the patient. That way you can get a better look and we won't be in each other's way.
So Brittany, is it better now that I started writing the questions down and standing on the other side of the patient?
Yes, way better. This way I won't tune out any questions you ask and I can work on the patient without feeling anxious about someone being too close to me. Is it working better for you too?
Yes, since I write down the questions, it allows me to go back and remember your answers and how you worked on the patient. I also now have a better view and don't feel like I'm getting in the way.